So this was a graphic I found that gives the new anticoagulants on the market. They've got Xarelto or Rivaroxaban, and then the other two that are still getting advertised. The Rivaroxaban and the Dabigatran are used to prevent strokes and used in patients who have AFib. At the time this was written, Apixaban or Eliquis was not approved for that. Or treatment of DVTs. The only one that is prescribed after treatment of DVTs and pulmonary embolus are Xarelto. And then given along with orthopedic surgery to prevent blood clots. Xarelto is also approved for that. Dabigatran is approved for everything but treatment of DVT, and the Apixaban is only for prevention of venous thromboembolism in orthopedic surgery. But these, like I said, still get advertised. These are direct thrombin inhibitors, and they prevent the formation of blood clots by interfering with thrombin, or factor II. So these are used to prevent clots in both arteries and veins. They treat deep vein thromboses and pulmonary emboli. They prevent blood clotting from atrial fibrillation, because that's the big danger, is anything that interrupts that flow of blood in the heart can cause the clotting factors to start working. They form little tiny clots, and then when the normal beat resumes, these little clots are thrown out into circulation, possibly causing stroke. I had a friend who just abruptly had a stroke. She was in her early 40s, totally healthy. One of those who, never, ever, ever eats any kind of junk food whatsoever, like totally natural, very, very good shape. And all of a sudden she just had a stroke. And when she was taken to the hospital, it was found that she had atrial fibrillation. Had no idea, hadn't felt anything different. The first thing she noticed was when her face drooped. She couldn't move her arm, and she couldn't speak. She gradually got all feeling and function back, but it was a very scary time for her, and she'll be on anticoagulants for the rest of her life because she just happened to have an irregular heart rhythm. Let's see, you want to decrease risk of embolism, because we remember that an embolus is a thrombus that travels. Instead of just staying in one place, it breaks off and travels through the bloodstream and can cause stroke and MI. And we want to prevent clots after some kind of surgery, especially orthopedic surgery, where they're working on large vessels, near large vessels of the legs, and then the person is going to be not moving the way they ordinarily do for a while. So these newer anticoagulants, these direct thrombin inhibitors, a lot of doctors really like these drugs, and of course the pharmaceutical salespeople are really pushing them. And there are some advantages to these drugs. They have a short half-life, so they can get out of the system pretty quickly. They're not as dangerous. They are very predictable on when they will be available in the body. And you can read about them in this article here by the Journal of Clinical Pathology. So we have the ones I mentioned on the little picture before this, Pradaxa, Xarelto, and Eliquis. And then there's another one mentioned here that was not on that picture, and it was Savaysa, or Edoxaban. These drugs are way easier to dose, and they require fewer lab tests. Unlike heparins, classic heparin sodium and the warfarin or the coumarins, you don't have to do a lot of lab testing on these. The only drawback with these drugs is right now there's no fast antidote for toxicity. If a person is taking this and say they're in an accident or they all of a sudden require emergency surgery, you can't give a reversal agent in the event of an emergency. For instance, heparin has a reversal agent. Coumadin or warfarin has a reversal agent, but these drugs don't have any. They are developing one for Pradaxa, but it has not been finished testing or approved, and so there is a risk of uncontrolled bleeding in the event of emergency surgery. But it's believed that a lot of the benefits of these drugs can outweigh the risks. They are new, so they're kind of expensive, but there is a patient assistance program for people who are put on these particular kinds of drugs. When it comes to nursing implications for these drugs, you want to keep these drugs in the original bottle, preferably a dark bottle. They're very sensitive to light. The most common adverse reaction to the direct thrombin inhibitors is abnormal bleeding, which makes total sense, right? Bleeding gums, once again, can be the first sign of abnormal bleeding. Avoid aspirin or the non-steroidal anti-inflammatory drugs like ibuprofen, because once again, both of those can also inhibit platelet aggregation. So you don't want to be giving your body a double whammy of drugs that inhibit clotting. And a lot of herbals will increase risk of bleeding. And there's a list of them here. And a lot of these are ones you hear of now that people are taking. St. John's wort, garlic, ginkgo, fish oil, turmeric. I think golden seal also is one. Let's see, ginseng. Many of these can also cause a difference in clotting factors, and if you combine them with existing drugs, you can run into problems. All right, so anticoagulants are what we'll talk about next. That's kind of a larger category, and that is discussed on the table on page 267. We have the indirect thrombin inhibitors, we have the low molecular weight heparins, as well as those thrombin inhibitors we just talked about. And this is a kind of a cartoon about what you see in the deep veins of the leg when there's a clot forming. Veins, as we remember, have valves, and when you are standing or walking, those valves help keep that blood flow go back to the heart. But sometimes if there is inactivity, tight socks, intrinsic things that can lead to clotting, like taking birth control pills or smoking or both, or just plain changes in our blood that happen with age, we can have little clots build up, especially around these veins or these valves of the vein. And as the valves move and try to send the blood back to the heart, little clots can break off and travel to the heart or the lungs, or you can get a big clot in those deep veins themselves that can be very painful and eventually very dangerous.